the last thing now is the follow-up. For the follow-up here, you have to point out the fact that what you should follow up different elements. You follow up the disease that is in neuropathy to find if the sensation is increasing or not. You find if you have different things. Now the next one is the electroneuromariogram, is the paraclinical follow-up method. For the cause, you have to follow up the different causes. You have said amyotrophic lateral, you have said Guillain-Barré syndrome, and all the other one. Guillain-Barré syndrome, when you have treated the Guillain-Barré syndrome, the patient can have back his functioning. Is it clear? Because what happens is that in those cases, you mostly have a neuropraxia. You may have a patient that has lost sensation, but he does not have a neurodemesis nor an adenodemesis, so he's regaining back his function. Is it clear? So the damage is when the damage is already done, it is irreversible. But when it's at the state of neuropraxia, it can be reversible. Is it clear? So when it's only at neuropraxia, particularly when you give high dose corticosteroid in order to relieve the neuropraxia, for it can be reversible back to the initial state. But when the patient has already arrived neurodemesis and acromegaly, it's already irreversible, and in that case you just need to do a surgery and end-to-end repair. Is it clear? So those are the different things you have to do. Now, to prevent the reoccurrence, you treat by the background. In this case, the background, you have to visualize all the etiologies that you can have. What are the risk factors that the patient should have spondylitis? You have said cancer. What are the risk factors that the patient has disc prolapse, maybe the job occupation and all that. So those are the elements on the background that you should visualize. For amyotrophic lateral sclerosis, what are the etiologies for that? Usually it's associated with intense sports. Is it clear that you can have amyotrophic lateral sclerosis, and it can also be genetic? You can have amyotrophic lateral sclerosis. So those are the different elements. So from here, when you have visualized that in the prognosis, you can now say that you have concluded. You have also to prevent the neuropathic ulcer. And when you have finished with that, you have said that you have concluded with the neuropathic disease and neuropathic ulcer. Thanks for your kind attention.